last hour. There'll be questions clearly about Halloween. There'll be questions, I think, about the National Guard testing plan. But I want to sort of put things in a context because unfortunately, Wisconsin continues to be at the wrong end of the list when it comes to what we're seeing with COVID in the United States of America. In the order that was issued by the governor today, he pointed out that there are only 2 states, California and Texas, that have had more cases in the last couple of weeks than we do. And those states are probably 5 times larger than the state of Wisconsin. And on a per capita basis, we're 3rd behind North Dakota and South Dakota. So clearly there are serious issues here in the state of Wisconsin with the spread of COVID-19. A lot of these surges are occurring not within the city of Milwaukee, not within Milwaukee County, but ultimately could have an impact here in southeastern Wisconsin as well. In fact, if you look at the national charts as to the cities that have had the highest incidence, you're going to see cities like Appleton and Oshkosh and Green Bay really at the top of the list nationally for the outbreak of COVID-19 proliferation. You're also going to see the Fox River Valley, the northeast part of the state, the area around Wausau, and the northern parts of the state, western parts of the state have been hit extremely hard the last couple of weeks, which all explains why the governor is taking the action that he's taking today. It also has an impact on us, and it's something that we had been contemplating and we had been working on, is the understanding that the work that we're doing with the National Guard would be temporary in nature. We've had the National Guard here in Milwaukee since early or late spring. And I once again want to thank Governor Evers, thank the National Guard for the incredible partnership that we have had that really, I think, allowed us to do a lot of very, very effective testing here in Milwaukee and the Milwaukee suburbs. So I want to focus my remarks on COVID-19 testing efforts here in the city of Milwaukee, again, to sort of put things in perspective. Yesterday, our numbers were 1,647 at UMOS on the south side. They were 805 at Custer on the north side. Those numbers are both higher than they have been last week. Last week, the numbers started going up, but these are pretty high numbers for those 2 sites. I think, not surprisingly, it's a reflection of the fact that with all the activity that's occurring in the White House, with President Trump, with all his advisors, more and more people are saying, okay, should I get tested? Should I get tested? But what that means is that this week's total is almost 10,000, 9,637 people who have been testing at these sites. But we know now that the National Guard is needed in other parts of the state, that the Wisconsin National Guard is beginning its plans to shift COVID-19 testing staff away from Milwaukee. That is not to say that we are going to be abandoned. In fact, we have been working very closely with the county, and I want to thank County Executive Crowley for his teamwork, Dr. Weston for the work he's done. The county has been a wonderful partner in all of this. And we've also worked closely with the governor, with his staff, with the National Guard to have an orderly transition. And when I say an orderly transition, what I mean is that we want to make sure that we're going to continue the robust testing that we have had in Milwaukee since May. And our goals are to make sure that it's accessible, to make sure that it's in different parts of the city, and to make sure that it's something that people can rely on. So I'm pleased to share with you our plans to create a consolidated, centralized community testing location at Miller Park beginning October 19th. So a week from next Monday, we will have a centralized drive-through location at Miller Park. And Miller Park brings a lot of advantages to this because of its location, because of the great cooperation with Rick Schlesinger and the Brewers, who have been phenomenal to work with in this as well. But we want to make sure that what we're doing is that we're going to be able to have a site that people can, from around the city and from the surrounding areas, utilize. And we feel very, very confident that we'll be able to do that. So to be sure that everyone is in proximity to testing, we are also going to have 2 what I would call regional sites for the city, one on the north side of the city, one on the south side of the city. That means we'll be using the Milwaukee Health Department's Northwest Health Center, which is at 7630 West Mill Road, and the Southside Health Center, which is at 1639 South 23rd Street. Those sites both will be opening next Monday. So that we'll have a week of overlap where you'll be able to get tested at Custer, you'll be able to get tested at UMOS, but you also can go to the Northwest Side Health Center or the South Side Health Center. The UMO site and the Custer site then will ramp down on Saturday, October 17th. So again, this will be a seamless transition where during the final week that those two sites are open, you'll also have the opportunity to use our Milwaukee Health Department sites. But beginning the Monday after the closeout of the two National Guard sites, you'll be able to go to Miller Park as well. This is going to result in actually more testing capacity, which is something that we think is very, very important. And in fact, the two testing sites in the neighborhoods will complement the Miller Park hub, and I think provide really the overlap that we're looking for to make sure that people in different parts of the city can take advantage of this. So our overall goal for Miller Park is testing site is to maintain the testing capacity we are currently offering at our Custer and UMOS testing sites, which is 2,000 tests per day. At the Northwest Side Center and the South Side Center, we'll be able to do 400 tests at each site a day. So our capacity is actually going to be increasing from 2,000 tests per day to approximately 2,800 tests per day. To be successful in continuing our testing efforts for the fall and winter months, we need to move to Miller Park as our main testing hub. Just logistically, for weather reasons, Custer and UMOS become more difficult, and we cannot appropriately weatherize those sites to protect staff and residents. You will see construction starting tomorrow at Miller Park that will allow us to have a hub at the hub for our workers to be able to do it there. But another important goal for testing has been to continue to provide community testing without barriers. This means that testing will remain free of charge, accessible without an appointment, and available even for those who are currently not displaying COVID-19 symptoms. But we want to put an exclamation point on who we do want to see come, and those are people who have been exposed to individuals or are symptomatic. Those are the ones that we really want to have tested, and Dr. Weston can go more into that. We also want to remove the barriers to transportation. We've been working with our partners to ensure the Miller Park testing site is accessible by public transportation. That's still a work in progress, and hopefully we'll have some news to report there. Now I think, do I turn it over to Dr. Weston or to the county executive? Again, I want to thank both of them for their partnership. So sitting on the side, who goes next?
We'll head to County Executive Crowley next.
I thought you were next, but my notes said something different. So let's go to the county executive.
Not a problem. Thank you so much, Mayor Baird, and thank you for your leadership on this. And just to touch on what the mayor has said, Milwaukee County definitely supports efforts to uplift no barrier COVID-19 testing options so that people can continue to get tested. We want to keep county residents safe, especially residents in historically underserved communities, and mitigate the spread of this disease. The Miller Park testing site is a city-led, but also a county-supported partnership. So I want to again thank Mayor Baird for his partnership in this effort to ensure we continue to provide access to testing. Milwaukee County is grateful to the Wisconsin National Guard for their support and hard work to keep two community testing sites open and running for the past 5 months. With the National Guard transferring this responsibility of COVID-19 testing to local municipalities, the Milwaukee Health Department is standing up testing sites throughout the city to ensure that residents have access to no barrier testing. And again, we are working to have some options related to transportation. The county is supporting this effort by acting as a fiscal agent for the project, but making sure that we provide support via our core team. The core team is our county's Office of Emergency Management's community-oriented EMS team, which is a group of specially trained paramedics within Milwaukee County. The core team will oversee the medical aspects of the testing site and ensure high-quality, safe testing is going on, but making sure that we efficiently move through the testing sites. We appreciate the core team stepping up for this effort because this is extremely an important initiative. And just to continue to talk about racial equity and access, we are committed to supporting testing for the most vulnerable populations. Given the disparate impact that we have seen in Black and Brown communities as it relates to COVID-19, we have a commitment to racial equity, and we are eager to assist the city of Milwaukee in this effort. The county is looking to support additional transportation options to Miller Park in order to ensure that site is accessible by public transportation. Options could include shuttles from surrounding bus stops to the site itself with proper capacity limits, but that have not been formalized yet. The Miller Park site and neighborhood-based sites are open to anyone throughout Milwaukee County. As much as we would like to see no barrier testing sites throughout the region, Milwaukee County, we don't have a health department, and we don't have dedicated funding for testing. However, we're always willing to support municipalities should they request our assistance, as the city of Milwaukee did in this case. The county's Office of Emergency Management has served in this support and coordination capacity since its inception about 5 years ago. And I want to once again thank Mayor Baird and Commissioner Jackson for their partnership on this. And as everyone has probably heard, about a half hour ago, Governor Evers announced another emergency order, basically reducing indoor capacity to 25% with some exceptions. I want to applaud the governor for taking this step to keep Wisconsinites safe. We have not had the opportunity to do a deep dive of the order itself, but we will be looking at the order and adjust any of our local orders accordingly. And with that, I would like to hand it off to Dr. Ben Weston.
All right. Thank you, Mr. County Executive. Good afternoon. First, as always, to our numbers, we've had 30,529 confirmed cases of COVID-19 in our community and 435 individuals who've died. There's certainly been a lot of thought, work, and resources put into planning this next phase of testing in Milwaukee County as we transition from the National Guard resources at our community testing sites to local assets. A big part of that effort has been determining staffing. In addition to local staffing resources and health department resources, as the county executive outlined, the Milwaukee County Office of Emergency Management is pleased and excited to introduce and implement a new team dedicated to community health engagement. The Office of Emergency Management, or OEM, has for decades worked with local and regional paramedics to supplement their day-to-day jobs with part-time work with the county as special event paramedics. While these special event medics have historically worked at event and gathering venues throughout the county, we obviously saw a pause in those events with COVID. In the interest of keeping those valuable members at OEM engaged, as well as serving the county's goal of advancing the health of all our citizens, we formed the CORE team. So again, CORE stands for Community-Oriented Regional EMS, and the CORE team is a mission-based team that will deploy for community health promotion efforts, starting with COVID testing and potentially in the future expanding to other initiatives such as vaccine administration or CPR training, as well as certainly continuing to support special events at those venue sites. At the community COVID-19 testing sites, the CORE team will help to oversee the medical aspects of the testing process with a specific focus on 3 areas. So first, we want to ensure that the testing process is as safe as possible. We really want to make sure that every person being tested and every worker on that site is safe and protected and not unnecessarily exposed to the virus. Second, we want to promote quality. Continuous quality improvement has been a fundamental principle in our Milwaukee County EMS system for decades, as we work with our 14 partner fire departments to ensure excellent patient care. And this is no different at the testing sites. We want to have every nasal swab performed correctly, every patient informed of the next steps after testing, how to properly isolate and quarantine, and that lab processing and data collection is done accurately to ensure the result can reach the patient in as timely a manner as possible. Third, we want to ensure efficiency of operations and flow at these sites. We know that everyone's time is valuable and want to make sure that you have to wait for as short a time as possible to be tested. So we're excited to introduce the CORE team in Milwaukee County. We have a great group already assembled, but are continuing to look for more paramedics and EMTs interested in the part-time supplemental position. Certainly any paramedic or EMT, whether you're inside or outside the county, if you're working for a fire department or a private EMS agency or other position, we'd welcome you to apply. And you can find more information on our Milwaukee County Office of Emergency Management Facebook page on those positions and how to get involved. Finally, I want to echo the mayor and once again encourage those with symptoms of COVID-19, those with close contact or who's tested positive, or those referred by a public health care or healthcare professional to please get tested. And remember, in addition to these community testing sites, we also have in Milwaukee County 16 additional healthcare and community health center testing sites open to the public regardless of insurance, income, or immigration status. And they can be found and accessed by calling 211 or visiting testupmke.com. Thank you very much. Stay safe, and I'll hand it back to Sydney.
Thank you, Dr. Weston. Next up, we have Rick Schlesinger, the President of Business Operations for the Brewers.
Thank you, Sydney. Obviously, we are a small partner in all of this, but always pleased to be able to provide the access that Miller Park does give to our residents for this testing site. It's great to see the local government officials working cooperatively and sensibly to provide testing. As someone who's been tested many times as through the MLB protocols, I can tell you that it is valuable. It is not particularly invasive, and it's really important for people, especially those with symptoms or those who have been exposed to somebody with COVID-19 to get tested. And again, to the extent that Miller Park can offer an accessible, way for people to get tested, we're pleased to be partners here, and again look forward to having people. We've been a little lonely at Miller Park this summer and this fall with no fans, and again, it's nice to have some visitors here, and again doing something that's really important for the county, and that's trying to arrest the pandemic, test and be safe and be smart.